Okay, so at the end of January, there was a notice that was circulated regarding doctors, and it said that the Grenada Medical and Dental Council has informed or is informing the general public and the Grenada Pharmacies Council that the following doctors and dentists who are particularly on that list were not able to legally issue prescriptions to the general public. And then there are a few doctors' name that was on that list, which also included your name. Talk to us about that, because I thought that was a very interesting note, given that I thought that yourselves or doctors and the council would share a cordial relationship, so that a notice of that nature would not get into the hands of the general public, providing that everybody does what they are supposed to do. So, talk to us about that. What was happening there?
Well, first of all, you would notice on that list that yours truly headed the list. And also, this is not by accident. This is a culture that has been going on for many years where, you know, it has been what we term locally as a fight down from the time I started my career. Now, that list would reflect a number of people who have been, I guess, negligent in a sense in terms of paying their license, but it's not for want of money or not wanting to pay it. Sometimes you get so caught up in your daily activities, running a busy practice, all of that, that some of these things, they just kind of get postponed in your mind, and you keep saying, oh, I have to do it, I have to do it. And at any rate, um, nobody gave us a heads up or a courtesy call to say, well, okay, you have not paid up, you are in breach of the regulations at this time, and we give you a certain time to pay it. And if you don't pay it by a certain time, okay, there can be consequences or something like that. And that is understandable. Now, nothing like that has happened. And in the middle of all of this, the Medical and Dental Council informed the Pharmacy Council, and the Pharmacy Council put this notice out there. I mean, this has, as far as I'm concerned, never happened before, where doctors have been literally prohibited from writing prescriptions, because at the end of the day, the people who are suffering are our patients. And to just put it out there without even a little warning reeks of something that is malicious. It reeks of people who are wicked and just spiteful and are trying to do harm to doctors, because, as you mentioned before, there's supposed to be a certain level of confidentiality, even cordiality between the two councils. And what does it take for someone within these two councils, whether it is in the Pharmacy Council or whether it is in the Grenada Medical and Dental Council, to just simply give us a reminder, a little courtesy call in this age of information, where you can send a message very, very quickly, whether it's WhatsApp, by email, or whatever. They have all this information, and they can easily have done that. But it was never done. And that is why I say it reeks of people who are malicious, people who are dedicated to trying to bring people down, trying to create a bad relationship between doctor and patient, and between the doctors and the pharmacies. Because I've had any number of calls from the pharmacies saying, oh, you can't write any prescriptions, and they stress the patients at the end of the day.
Right, right. So
They
Mike,
and they send the patients away without recognizing the damage that they are causing to the patients. And then they go to maybe another pharmacy, and they would get it. But the point is here is that a lot of people right now are disowning responsibility for that activity that took place, that act, that vicious act of maligning people by sending this thing out on social media, without prior notice or anything like that. And it has caused a lot of embarrassment for us. It has caused, you know, a problem with our patients in terms of the confidence that they have in us. It has caused a problem with the pharmacies, and also the fact that, you know, we depend on the pharmacies to give the patients their medication once the prescriptions are presented. And this has not been the case. Now, since that time, this condition has been resolved as far as living up to the responsibilities that we expected to live up to in terms of getting the insurance, in terms of paying up the license fees, and all of that. And it was so quick to be put out that we were not compliant with the regulations. But at the same time, now that it has been paid up, in my case in particular, tomorrow is going to be 2 weeks since I rectified everything, and not a single notice has gone out to the pharmacy saying that that situation has been rectified. I can give the case of another doctor who's on that list and who paid up around the same time as me, and her name was removed from the list forthwith the very next day that she paid. You see, mine is going on 2 weeks now since I paid, and up to now, notification to the pharmacies has not been forthcoming up to this point.
And what's the point of redress? Like, who do you go to have this rectified? Where are you with that scenario now that you have paid up, as you would have said? Um, who is to act next to rectify the situation?
Well, the people who have to act are the people in the Grenada Medical and Dental Council, and they should have sent out a notification almost immediately to the Pharmacy Council saying that the license problem and all of that has been resolved, and that that list which prohibits doctors from writing prescriptions is now invalid because our side of the problem has been rectified. Now, this has not been done in my case up to this point. I don't know about other doctors. I know about one other doctor, um, one other doctor who was on that list has made her payment, and the very next day, her situation has been resolved and rectified with a notice from the Pharmacy Council. So I'm just showing you the disparity, the differences in the way people deal with things when it comes to me as opposed to other people.
Mm-hmm. And what would you say, if you have any idea, is the motivation or the reasoning or reasons behind the difference in treatment that you receive, and the as you were saying, that discourtesy that has continually been extended to you?
Well, it's a pattern of behavior when it comes to me. As a matter of fact, um, if I may say so for myself, you know, there's a total lack of ethics, total lack of confidentiality when it comes to certain matters, and they will protect some people while they will malign others. And in my case, there's a clear case that, you know, what I have faced not only through this action right now, but what I have faced throughout my career from the time I returned to Grenada in 1986 to now, that situation has continued. You remember in 1986, when I came back to Grenada, I was banned from working for 4 years. And my only crime was that I opened my mouth and I defended our right to work as Grenadians because we were sent away by government to Cuba to study, to return and serve the Grenadian people. In my case, being the leader of the students when I came back and facing the mountain of problems that they placed in front of us by the then government of the day, the Blaze government. I had to stand up and fight for our rights. And in so doing, they allowed everybody else to get into the pre-registration internship program. And in my case in particular, I was banned not just for a few months, but for 4 years. I couldn't earn a cent in my own country after having gone abroad and studied medicine to come back and serve the people. And only because I opened my mouth in a time when they said that quote unquote democracy had returned to Grenada, and I couldn't even open my mouth. I was banned for 4 years, and it wasn't until the NDC government in 1990 came in of Nicholas Bradford that I got my right to work back. Now that pattern has continued. After I set up my practice, I pretty much revolutionized the way things were done in private practice. I first of all extended my hours to hours that people never used to have before. Most people around that time would have hours between 8 and 12 o'clock, and they gone home after midday, and that's it. In my case, I advertised hours from 8 until 5 o'clock. This was new. I also set up the first one-stop clinic where I provided comprehensive medical services that would provide for you in the space of a day or in a few hours a diagnosis based on the investigations that we were offering at the time. So we were offering uh, clinical laboratory, we were offering X-ray services, mammogram services, ultrasound services, electrocardiograms, all of these, and it became a hub for people to come, and get everything done in a short space of time compared to what existed at the time at the general hospital, where sometimes you have to wait for days and days and days before you could even get a laboratory result. Now, when I worked there and I saw how things were being done, I decided, no, I'm going to change things in my practice to reflect the way I think a practice should be run and how patients should be treated, and how results should be received in a timely manner so that you can get a proper diagnosis. And one doctor in particular that I went to school with graduated at the same time. She went abroad, she studied, she became a gynecologist. And from the time she reached back to Grenada, she just decided that she wanted nothing, no results or anything from Marryshow's clinic. Absolutely nothing. And she issued a decree at the general hospital whenever anything came up there that she didn't want it. And these are the kinds of things I had to face. Up to now, I'm facing it. And for years, anytime that anything went up there, she would throw the paper in with the results in the patient's faces, and said she don't want anything, and why are you going to him? He's not a gynecologist, and that's the kind of things. And I get the feedback from the patients all the time because they want to know, well, why it is they have to come to me, pay money to get something done, get a result, and when it goes up there, it is not accepted, knowing full well that I'm a qualified doctor. And even when it started, this whole culture of rejecting things, I wasn't even the one doing ultrasound services. The person doing the ultrasound services was a doctor that was eminently qualified, who came from Cuba to work with me as a gynecologist. I mean, you couldn't get a better doctor in terms of qualifications. You couldn't get a better doctor in terms of surgery and technique. He did the ultrasounds at that time. All I did, because he was not as competent in English as I was, I would be the one to sort of translate the ultrasound report as he dictates it to me, and then send the report up to the hospital with the patient. She would reject it completely. And for everything that was done here, whether it was the labs or whatever it is, she rejected everything that was done. And that continued for years and years and years, up to today. Today, I had to go to the St. George's Health Center to rectify a situation where one doctor said, rejected a result that we sent. The patient was sent to another place to do the same test again. They made the patient go and repeat it. and the result was exactly the same. I'm just saying that. I'm just saying that to say that, you know, it is not anything by accident. You can see that there's a deliberate attempt always to try to bring me down or to try to discredit what I've done or to demean my professionalism over the years, and that has not stopped. I can even give you another example. I think I must be the only doctor in Grenada who has been sued for something that he didn't commit in the medical field, because normally, people don't really sue doctors. Now, that same gynecologist that worked with me did a surgery some years ago, and many years ago, when he worked with me on a patient who had a problem, you know, with abdominal pain. When we really checked out, what she had was really inflamed fallopian tubes. Now, she had to undergo surgery. And when we got in, we saw she had two inflamed fallopian tubes, but she had a wish, an enduring wish that she wanted to have a child. So instead of taking the both of them out, we respected her wishes, and we left one of them in with the hope of giving her a chance to procreate, to have the baby, this precious baby that she wanted to have. And so we left that tube in. Well, obviously, it would take some time before that inflammation would have gone away. So she continued to have pain. Maybe about 3 months after the surgery, she was continually having pain, and she went to a doctor in the medical school. The doctor referred her to the general hospital. Surgery was performed on the lady at the general hospital. She died at the general hospital under the watch of that particular surgeon who operated on her. And to cover his tracks, he encouraged the family to sue me 3 months after a surgery that was done by us, where there was no problem. She was discharged. She was going about her business. She was seen in funerals. She was seen all over the place. And people who didn't understand who her condition, who never consulted us even to find out what was done with her or nothing like that. They operated on her. She died at the general hospital. And I got sued for, well, of course, being the owner of the facility. The surgeon is the one really who performed it. But when we did surgery on her, she lived. She was discharged. When somebody operated on her at the general hospital, she died at the general hospital, and I'm the one who ended up getting sued. I went to court. I won my case. Damages were awarded to me in the amount of $18,000 that I paid out of my own pocket to resolve this problem. And up to today, just as so after the 4 years of depriving me of my right to work, a right that is enshrined in the Constitution, I never got compensation for that. And after that surgery, after spending $18,000 to defend my good name, I have not received up to now a single cent of damages and the money that I had to spend to defend myself. That's what has been going on. These are the kinds of things. And over the years, there's no end in terms of, when things go up to the hospital or they go to the health centers, and so that they are just trying to discredit everything that I do. But as I say always, everything I've done for my patients. And my record over the years is an impeccable record as far as I'm concerned. In all the years that I've done deliveries of babies, we have never lost a baby at my facility, never. In all the years that we have done surgery, we have never lost a patient through surgery. And I am the one that does the majority of deliveries. Even when I have gynecologists and obstetricians working with me, I still am the one that does the deliveries. And I can tell you that is the kind of record that we have had. And everything that I do it in the best interest of my patients. I don't, have any pretensions about trying to be the greatest doctor on earth. But I know that everything I do it sincerely. I know that I do it out of the the goodness of my heart and my conscience. And my greatest concern is the welfare of my patients. And when people try to denigrate my efforts and what I've done over the years, having served for well over 30 years now, and still at this stage of my life where I've reached retirement age and I've passed the retirement age and serving still, that people are still trying to bring me down, this, I'm not going to take up without a fight right now. You understand? And even going back to the whole question of the license and all of that, up to now, that notification 2 weeks later has not gone out, and I'm still wondering why it has not gone out. Right now, a lot of people are distancing themselves. They're trying to distance themselves from that responsibility of who allowed that information to go out, um, so that the public is informed about all of this. When it's supposed to be something that was confidential, something that should have been resolved behind the scenes, but there was a deliberate attempt, a malicious attempt, not to resolve this thing amicably, but to try and smear the name and the character of the group of doctors who are on that list, and in particular, my name, who heads the list.
All right. All right, doctor. And so this engagement, this interview is basically to set the record straight, to give your version of the story, and of course as well to appeal to the authorities, be it the Grenada Medical and Dental Council or the Grenada Pharmacies Council, to at least to give you the same treatment that they extend to other doctors.
Yes, pretty much. That's what it is. I think if I might say so myself, enough is enough. Um, I don't really have to be in this situation at this stage of my life. And I'm not asking anybody for thanks, because I get those thanks from my patients every single day. Um, when I see them in the road, or whenever I see you know people know that I'm delivering babies of babies that I delivered. In other words, when people see me now and they tell me, "Oh, that's your baby there," and I'm just amazed, when I see, it's really big people, and that's a thanks for me, to see that, this is somebody that I help to bring into into the world, and now they growing people and doing well. Or when a patient meets me in the road and said, "Oh, you did this surgery on me, and I don't even remember that," and look at how well it was done, or just thank me generally for helping them, or being kind to them, and that they're feeling much better and things like that. That's the satisfaction for me, and nobody can take that away from me. Already in all of these years, I've seen well over 40,000 patients, um, over 40,000 patients in my practice, and despite what anyone says, or what anyone tries to do outside it to try to tarnish my image and my reputation, that they can't do it. The work that I've done is not for those who try to belittle me, but for the very patients that I see every single day and try to do my best for them.
All right, wonderfully said. Dr. Marshall, thank you for sharing this moment with us. Of course, we really wanted to hear your side of the story. We understand how it affects you, affects your business, and affects your patients. And so we are happy to at least get the word out there on your behalf.
All right. Thank you very much, Mikey.
Thank you very much, Dr. Marshall. All the best.